Traditionally, your medical records will be held on a mixture of IT systems and also that huge bundle of paper records that you may see which represent your patient notes. With UCLH being across many hospital sites, this can lead to great inefficiency. Can you imagine if your clinician in one site needs to have access to your paper records in another site? Those paper records need to move from one site to another. This leads to delays and potentially your medical records may be mislaid. Also, the IT systems at these specialist units don't always talk to each other, so this leads to inefficiencies and also replication of information. So it makes it very difficult for clinicians to access up-to-date information wherever and whenever they need it. I'm sure as a patient we've all been asked to provide information again, the same information that we provided earlier to another clinician. So clearly there's an urgent need for change, which the Trust has recognised. And what they're doing for us, the patients, is the implementation of an electronic health record system. This will replace that huge bundle of paper with one electronic record of your care. What we should see as patients is greater efficiency, less appointments being cancelled, and greater use of handheld devices by the clinical staff as they input information about your clinical care immediately. So then it can be accessed immediately by other clinicians across the Trust. Well, as you can imagine, the implementation of the electronic health record system has been planned for many years. There's been a lot of work in the background, including consultations with patient groups and also many hours of training for the thousands of staff across UCLH. Nevertheless, despite all these preparations, we may face some initial delay as staff become familiar with what is currently unfamiliar ways of working.